Good afternoon, everybody. Welcome to the second of our webinar series focusing on perinatal equity. My name is Terri Deeds. I'm one of the clinical leads for CMQCC, and we're going to move forward and hopefully give you some actual tools to get started in this work. Next slide. So hopefully you attended our first webinar, which was held on May 2nd. This gave you a little background information on the work that we're doing in this space. And we hope that if you didn't get a chance to participate in that we encourage you to go and review the recordings and slides of that kickoff webinar so you have the context and the foundation for the work that we are undertaking today. Next slide. So our objectives today is we're going to have some exciting news and talk about the Hospital Action Equity Guide that we are about to introduce to you today. We're going to show you how to access it. We're going to talk about examples of readiness assessments, and we're going to talk about some of the tools and resources that are available for you in this action guide. So just a reminder that in order to access the Hospital Action Guide, it does live on the CMQCC accounts page. And so you will need a CMQCC account in order to access that. This is just a screenshot of that page to actually, that walks you through how to create a CMQCC account. You can either use the QR code that's on this screen, or in the chat, there is a link that will take you there. This is not the same as having a link to the maternal data center. So if you don't have access to data, that's okay. As long as you're affiliated with one of the California hospitals, you can create a CMQCC account, which will allow you to access anything on our website and help you get into this action guide. Next slide. Okay, so today it's my pleasure and my honor to introduce the speakers that will be talking to you today. Dr. Amanda Williams is our clinical and medical equity lead, who's working with us on our learning initiative and really coaching us along the way in this equity work. Dr. Kendra Smith is CMQCC's birth equity advisor, and she's going to talk to you a little bit about one of the tools that we have created within the Hospital Action Guide. Christa Sakowski is one of the other clinical leads for CMQCC. She has done most of the work on the toolkits that you are all familiar with CMQCC, and she's also the co-lead for the learning initiative around the NTSV Equity Project, which I'll talk a little bit more in a minute. My name is Terri Deeds. I am one of the other clinical leads, and I am the alternate co-lead for the learning initiative that is really moving this equity work forward. Next. So with that, I'm very happy to turn this over to our colleague, Dr. Amanda Williams, to help you understand our new and great tool to help you walk through this work.
Thank you for the warm welcome, Terri. And hello, everyone out there. We're excited to have you join us and to really dive into the work and to give you the tools, give you what we've been working on for so long to see if we can all keep moving forward on this journey. Next slide. Now, before I get started, I do always have to do my disclosures. In addition to my work with CMQCC and at Stanford, I am the medical director at Mommy, which is a venture-backed, tech-enabled pregnancy and postpartum wraparound services company that is aimed at elevating maternal health equity and supplementing traditional perinatal care. And I'm also an advisor at Risk LD, which is an obstetrics alerts and decision support software that seeks to take some of the bias out of how we respond to alerts. So whatever my platform is, I am always working on maternal health outcome improvement, and in particular for ways to shrink health outcome disparities. Next slide. All right, so let's get started with the goal of improving maternal outcomes for all women and birthing people. CMQCC and its partners developed the Hospital Action Guide for respectful and equity-centered obstetric care. and we'll call it for short the Hospital Action Guide. And as per the last time we did this webinar, we still haven't come up with a cutesy little acronym yet, but all these things really mean a lot to us. Respect, being centered in equity, and really being about the hospital and about obstetrics. So if anyone comes up with something, please, I'm still waiting. So the purpose of the Hospital Action Guide is twofold. First, we want and are hoping that California hospital users understand the drivers of the inequities in maternal care and deepen their understanding of how racism, discrimination, implicit bias are root causes of maternal inequities. And second, and really what's most innovative, is that the guide will provide hospital team, maternity team members with samples of equity-centered tools and resources that go beyond implicit bias training. You guys have checked the box, you've done your training, and now what? How do we translate that into real change in culture and real change in care for our patients? I'm sure many of you saw the CDC article that came out this week, looking at the study of patient care experiences in the maternity setting and how mistreatment happens in this space. And when we say, what can be done? How can we do things differently so that our patients, especially our brown and Black patients, especially our low income, uninsured or state insured patients, how can we make this different? We hope that this guide is part of the solution. We want to be a part. It is certainly not the whole thing. We cannot boil the ocean, but we as hospital folks have a job to do to make this better. So the way that the guide works is that right now it is exclusively available to our CMQCC hospitals inside the state of California. And as Terri alluded to, through the accounts portal. And I'm going to go through that in detail in just a minute. But we hope that with your feedback, with the iteration process, we will eventually be able to share this across the country. Now, the guide is broken down into modules. The first module gets us started with understanding the need for birth equity to enhance equity, reduce disparities, increase safety, and meet regulatory and legislative requirements. Next, in Module 2, it's to identify opportunities for collecting and sharing stratified data on patient experience and outcomes. And we'll harken back to our maternal data center inside of CMQCC and how we can use that stratified data. Then in Module 3, we examine current equity practices that are going on in your hospitals right now to make informed and meaningful action steps. Then in Module 4, it's about leveraging patient care processes and outcomes data to address obstetric disparities. Then 5, we all know about culture. We all know that culture eats strategy for lunch. We live by that saying. And so how can we create a culture of respectful care? And then the last module is so important and a new horizon for us. How do we create partnerships with community? How do we think about bridging when patients leave the hospital, what happens with them next? Because we know that there is a gap when patients leave our hospital. So we've got to have strong relationships. At the end of this, you will all have access to the first 5 modules, and then Module 6 is still in development, and we will be holding a special webinar when we launch Module 6 later in the year. Next slide. So now what we want to do is do a little more of the nitty-gritty to really do a show and tell of the culmination of the last year and a half of work that we've put into this. And truly, a year ago, I was a hospital leader inside the Kaiser Permanente system in your seats. So it really, and Terri and Christa, so many of us have worked, Christina, in the hospital setting, so we know what it's like to be on the receiving end. end. So we're trying to design things that truly do, we can imagine being put into action. So you'll see, we'll highlight with the red box, the next is your accounts login. So what you're looking at here is the main CMQCC site, and then you'll see the accounts login, which is how you normally would enter in as a user. Next. This is where we have our landing page for all the different tools that you might be using inside of CMQCC. And we'll highlight where you can see the hospital action guide. So this is the same place you might get huddles, the same place you might go to the maternal data center. And here, this is where you're going to enter into the hospital action guide. Next. And then this is the guide landing page. This is what opens up next. So, since 2019, CMQCC has been working collaboratively with our 5 pilot hospitals, and we'll talk about them a little bit later, but we are deeply indebted to them because they're the ones that helped develop, implement, and test tools and protocols aimed at improving equitable practices, in addition to consistently delivering respectful care. So the Hospital Action Guide is part of that set of tools. So when we look on the left-hand side of the landing page, you can see that's sort of like a menu that is where we'll see the different modules, and you'll also see an introduction that says start here. There's also the link to the webinar, and we'll see this in more detail later, an acknowledgements and feedback section where we thank our pilot hospitals that I just spoke of, and then also a place where you can give feedback. This is supposed to be a living, breathing entity. And so we will be going back and doing expansions, revisions, and we truly do depend on you for that. Next, we'll highlight that there's also these different icons here that are places where you can enter into the different modules. So you could enter through the menu, or you could enter through the icons. The guide is intended to be undertaken in sequence. So truly, it's start here at the top and work your way through. However, we acknowledge that every hospital is at a different stage in their maternal equity journey. So there may be sections that are less relevant to your organization. So you can, of course, skip sections. Modules can stand alone, but they are intended to be done in sequence, and there is some building from one to the next. So if you go to the next slide, this really shows us the guide home. And you'll see at any time when you're here that you can return to the home page. And so that's what the red box is showing us. And then in the first start here icon, you can navigate through, again, on the left menu bar or by clicking each module. We do want you to at least watch the intro video, listen to the intro letter, and that will give you a welcome video and the start for some recommendations on how to use the guide. Next slide. So let's take a deeper dive into one of these modules so that you can get a sense of how they're structured. So what we're going to do is preview for you Module 3. So first we'll highlight the learning opportunities. So each module starts with a set of learning opportunities, which are sort of like the objectives for that module. And then we'll also note that each module also has a welcome video, which is the sort of Cliff Notes intro to what happens next. Next slide. And then inside, you can see the specific objectives and the opportunities for you to begin. Next slide. So we're going to start out with examining the current equity practices. So clicking into this, you're giving an introduction to the work, and then we bring you into action. Next. And so here you have the opportunity to start with building your team to get started, and then looking at integrating equity into unit-based policies and practices. So first, it's the building of the team, figuring out who are the ideal people to be there, making of a charter, and then what are the policies and practices that might be going on your unit that may intentionally or unintentionally be impacting your culture of equity. Next. And here you can see the action steps. So these are really the detailed items that we are hoping will take place. So for example, reviewing hospital policies, procedures to make sure that equity is addressed, meeting with your human resources team so you can think about recruitment and retention. And so these are things that your committee can be doing as you're moving forward with this work. Next slide. And then the last one is to scan your department for diversity imagery that may be more or less inclusive and may reflect or not reflect cultural concordance with your patient population. Then as you're taking these action steps, we want to make sure that you have plenty of resources, other examples of how hospitals have approached this. So in the red box, you'll see that these are resources to take action, and these blue links actually will pop up a new window so that you can look at the paper that we are alluding to. And then the last piece of this particular module, the last learning opportunity, is to evaluate current practices for assessing patient health-related social needs and referral to resources. So that is the last of these learning opportunities, inside of which we'll find action steps, and inside of each of these, you'll also find resources. Next slide. And then this just shows you how you do pop those out. So as we're looking at these resources, you click on the blue and that it will open a new window for you so that you can see an article, you can see a case study, so that your team has examples to work with. So we're not just saying, do this, we're saying, okay, and here are some examples of how you might get this done. Next. On this left side menu, you'll also see the webinars. There are many ways to get to the webinars. They're on the front page of CMQCC, and here inside the guide, you also have the webinars on this left-hand side menu. In case you have a new team member joining, that's a great place to get them oriented. Next slide. And then that QR code that you can see there is an opportunity for you to give us feedback, and we cannot be better unless we have feedback. So as you and your team, your committee are working through the guide, please do give us feedback so that we can continue to improve. Or if you stumble across a resource, an article, a case study of this type of work that is not listed here, please do let us know. And then inside, we also have our thank you, our deep thank you to our Birth Equity Task Force. Big thank you to our 5 pilot hospitals, because truly we certainly could not have gotten here without you and without you putting in the work to testing some of these tools. We certainly want to thank our writers. We had external reviewers. We really tried to come from all over the state, all different kinds of practices and trainings to make this as user-friendly as possible, as actionable as possible. And then lastly, at the end of it, there are some additional resources that you can see on the left-hand side. And Christa is going to talk about this later, information about getting to office hours. And that is intended for people who are doing it themselves, not necessarily as part of the collaborative, our collaborative that's in the NPSV through an equity lens. But for others who want to ask questions, that's how you would access it. So hopefully this has been a useful little color by numbers. And at the end, we will certainly take your questions. Thank you. Terri, it's back to you.
Thank you, Dr. Williams. I appreciate it. So I'm going to talk a little bit now that you're familiar with where the action guide lives and how you can use it to help you on your journey. We're going to talk about one of the first things that we think you should consider doing as part of your implementation interventions. And that's really about conducting baseline equity assessments around this work that you're about to undertake. Next slide. So these objectives for this section is that we really want to kind of outline the difference between collaborative and learning initiative nomenclature. I've had a few questions about that and why we are using that terminology for this work that we're undertaking right now. I want to outline there are what we consider the recommended types of baseline equity assessments. I'm sure there are more, but these at least as a baseline. And then finally, let's identify some resources to conduct some baseline equity assessments for you. Next. All right, so most of you are very familiar with CMQCC and the work that we do and have probably been involved in collaboratives with us in the past. So I wanted to talk a little bit about that concept and where that came from and why we have chosen to use it up until now. So really the concept of collaborative learning obviously increases knowledge and skills. We all agree with that. It also heightens the ability for one to acquire knowledge and to actually retain it once you learn it. It improves relationships amongst teams and departments who are actually working on your quality improvement team within your organization, and really sometimes let you work with departments that you don't normally work with, which is a definite plus. The other thing that we have learned is that you learn from each other on these calls, which is probably one of the best things about a collaborative experience. And it promotes the idea of learning from others' viewpoints, people who are in different roles or different organizations and that kind of thing. What was interesting when I was doing a little bit of research on this is that there is a learning theory of social development developed by Vygotsky, and it was really the idea that the idea of community and learning together is an important aspect of how you get knowledge and how you get support for the work that you're doing. But what's most important about collaborative learning is the concept of an MKO. It's the more knowledgeable other in that equation. And it's the assumption that there's someone within this collaborative group who has already had the knowledge that the rest of the people are seeking. And I think it's fair to say that all of the collaborators that we've run up till now, that probably was true. We had extraordinary partners and subject matter experts who got together to create the content within those toolkits and to help lead those collaboratives who really were those people who were more knowledgeable and who were able to publish on this subject, etc. And so that seemed very appropriate. And when I was reading this, it's like, yeah, that applies to everything that we've done up until now. Next slide. So when we were planning for this, as Dr. Williams said, about a year and a half or 2 years ago, I was able to spend some time with IHI and I talked to them about what we were going to do. And they made a recommendation that we not call this a collaborative. And again, the more I researched, the more I agreed with them. This is really more of a learning initiative. And it's a program similar to collaboratives in that we're helping people develop skill sets and to master new concepts that they're going to need to do this work. But there is really a very strong focus on mutual learning so that everybody in this space is learning together and that we are understanding from all participants, and you don't necessarily have to have an expert to drive this work. And so I think it's really important for us to talk about the fact that we are building upon years and years of work of people who have been in this space and working on equity. We feel like we have the quality improvement skill set that allows us to bring people together and to have these conversations. But we are all immersed in this learning just like everyone else. And we hope to learn from all of you as much as you are learning from us. And so we are not putting this out there as this is somebody who's an expert and we hope you take and do everything that we're putting out there. This is going to be a little bit different. We're going to give you a whole lot of information that we've kind of researched. We're going to give you some tools. However, the tools are designed so that they can apply to the organization as you are currently in it. So maybe your values are different than organization values down the road. And so how you implement these tools may look very different than what is going to happen with other people involved in this work. And that's okay. It's more important that every institution is working on equity, not that they all end up looking the same, which is kind of contrary to what we were trying to accomplish in the collaborative, where we kind of wanted everybody to do a same set of structure measures and that kind of thing. So we do have structure measures for this one, but it's really for everybody to take the tools and now apply that to their organization, however works for them. So I want to talk a little bit about the current learning initiative that we have in place. And it is, as you know, CMQCC likes titles. So this is the learning initiative to support vaginal birth through an equity lens. It is the result of some CDC grant funding that we have to run a 5-year program to help focus on equity tools and resources to really enhance a culture of respectful care for everyone. And we're going to measure that through NTSV rates. As we all know, it's the cleanest measure that we have because it's kind of applies the same to everybody. So this learning initiative currently has 14 hospitals in it. We started it about 3 months ago. We just finished our 3rd month of it. And they are going to be using the exact same hospital action guide that you are seeing here today. We're just going to do a little more deep dive every month on how to implement some of the tools that are in there. So we're learning from them. They are kind of functioning like, they're not kind of, they are functioning as our expanded pilot group to really give us more feedback on the resources and the tools and the things that were field tested by our original 5 pilot hospitals in our birth equity collaborative. So hopefully you will all benefit from the work that they are doing and the help that they are giving us to continue to refine and enhance the action guide and for all of you to use. The plan is for us to launch a 2nd round of that learning initiative, probably after the 1st of the year. We're thinking maybe February, and we're going to run them simultaneously 2 at a time after that, and potentially 3 at a time in 25. And the program runs for 18 months. long. Dr. Williams is the medical director serving as our physician champion for this work, and Christa and I as clinical leads are co-facilitating it. So hopefully you'll hear a lot about this work as we move forward, but I wanted you all to understand the work behind the scenes that is going on at the same time this action guide is being introduced. Next slide. So let's talk a little bit about baseline equity assessment. It is basically an idea to figure out where are we and where do we need to go. So if you don't understand your clinical environment, it's hard to understand your next steps. And it's critical before engaging in any QI initiative. And most of you who have done quality improvements have done this sort of driver diagram or something like that before to understand where are you at and what do you need to do next. It helps you understand to identify the gaps in the current work that you have. And then once you identify those, and how do you prioritize the work that you're going to do? It provides a way to actually maximize the strengths that you have. There is an assumption out there that everybody is doing something really well in this space. Let's maximize that and take credit for that, and then figure out how do you expand on that to actually address the opportunities that everybody has for improvement, and we all do. And hopefully some of these tools will assist these teams in working on the QI work around equity. Now, the most important part of this slide is the bottom line, which is it is critical that a baseline assessment is done. It is not necessarily critical which method or which tool you use to do it, but that it is done so that you can actually drive your work moving forward. As an organization, CMQCC does not promote one approach over another. It's just our point is please do a baseline assessment so you kind of can direct the work forward. Next step. So we think that there are probably 3 areas in which one should do baseline assessments. Number one, which I think is what most people think about, is the organizational or unit structural assessment. And whether or not you are working on this from an organizational top-down, or whether you're using this on a unit-based bottom-up assessment, it can work either way. But it's a way to actually ask yourself questions and see what the current structure allows around the concept of equity. So looking at hiring practices, interviewing practices, policies, processes, all of those kinds of things that are very structural in nature that you need to say, okay, do we have these in place, or maybe there's some ways we could make them better, that kind of thing. Then I think it's important to understand what is the feeling around equity amongst the people who work in your organization. So your staff and your providers, and let's understand what they feel is happening in the area of equity on your unit. And then thirdly, what do your people who are using your services feel? So what is the patient experience like with respect to equity and respectful care? We understand that everybody does HCAHPS patient experience surveys, and that's lovely. To date, HCAHPS has not included equity in their patient experience. I do believe that there is some work being done on that from the national level. But right now, I think the important part is to get some feedback from the patient voices of those that you are serving and how they feel the experience relates to equity and respectful care on your unit. Next slide. So in the very beginning of this work, I don't know, 2019, something like that, we decided to start working on a tool. And trust me, I'm not asking you to be able to read this. That was not the intent. But we came up with what we considered was a way to get started on this work. And this is a SWOT analysis. And for those of you who are familiar with SWOT analysis, it's an idea for you to look at and identify the strengths, weaknesses, opportunities, threats, and trends that are affecting your organization with respect to equity. This is designed so that it is asking open-ended questions. There are no yes, no answers here, because we really want to stimulate dialogue. Because if you have questions that are easy yes, no, sometimes you miss opportunities to actually think a little bit deeper about some of these questions. And you may find other questions to add to it, which would be great. These are just things to get you started to think about. And then go to the next slide, and we'll talk a little bit more about so again, these are the sections: strengths, weaknesses, opportunities, threats, and trends. And again, You probably have really good strengths in your organizations about how you're managing certain things. You might have an opportunity that is coming your way that is going to allow you to think about something differently. You may have self-identified weaknesses in certain areas that you need to look at. You may have threats that are coming. You might have hospitals nearby who are closing and you're going to have an increase in patient flow. You might have some trends where you have different physician groups that are coming in, or you're switching to a midwife-based care, or you're adding doulas to your organization. There are things that are going to change the way that you do practice, and it happens to all of us. And so can you identify those and how they might affect your equity practices? It is important to decide when you're doing this, whether or not you're doing this from an organizational view or a unit view. So is this 20,000 foot view? Is this unit view? You can be both, but it would be really nice to say, here's where we think we can work on this. It is designed purposefully on an Excel format. So the idea of that is that you do this as a baseline, and then we hope that it's a very dynamic document, so that you look at it maybe a year from now and you say, okay, let's look at this again. Maybe now some of those weaknesses or opportunities have turned to strengths. So because it's in an Excel format, you can take those cells and move them to the different column now. Or maybe one of your strengths has now become an opportunity, so move that somewhere else. But it allows you to look at your progression over time on how this is happening. It also encourages you to look for any new threats or trends that are coming your way. So it's a way to identify improvements, to look for new opportunities, and redefine your strategies as you're moving forward. Again, just one option for ways to do baseline assessment. It's not the only one, but people were asking us for tools to use. So this is one example. Next slide. Another one that is really good comes out of IHI, the Institute for Healthcare Improvement. And it's in their white paper, Achieving Health Equity, Guide for Healthcare Organizations. Now, this one is very much done at an organizational level. It is divided into their components of care, which you'll find in their white paper, and it's done on a Likert scale. So basically rate yourself 1 through 5 on each of these things. And then as you keep looking at it again, are your scores improving over time? So again, another opportunity. Again, there are a lot of them out there. We're just giving you a couple examples. It doesn't matter which one. We're not promoting one over the other, just giving you some choices. Next slide. So I'm going to finish here. I am a big baseball fan, and so when you got to do quotes, Yogi Berra is probably the top of the list for me. So if you don't know where you're going, you might wind up somewhere else. So that's something to think about for the rest of the day. And I am now going to turn this over to Dr. Kendra Smith, our esteemed colleague and birth equity advisor, to help walk you through where we are currently on our culture of equity survey. Dr. Smith.
Thank you, Terri. Hi, everyone. It's really good to be here. And I'm so glad that so many of you showed up. Consistent with the things that Terri discussed in terms of CMQCC, not mandating or prescribing a certain set of tools, but giving you options and opportunities to see what these tools are. CMQCC has also developed the Culture of Equity Survey in-house, which we're making available and which I'll discuss with you now. So the Culture of Equity Survey, next slide, please, is designed to assist leaders with gaining perspectives from staff across their unit on the current status of equity efforts in the unit and the organization, as well as overall unit experiences. And so the survey is developmental, meaning that the results should inform and guide ongoing decision-making to support continued quality improvement with specific attention to equitable and respectful care. So it's essential for us that leaders who are implementing QI work have as much valuable data as possible to guide and justify actions. And we hope that the Culture of Equity Survey can provide that. Even if you're in the infancy of your equity work and whatever that means for your hospital, this is still a good opportunity to understand, to create a baseline, to establish a baseline of where you are, and to continually utilize the survey annually to see how things are progressing or maybe not progressing, and to help guide your activity. So the survey is organized into 6 parts. First is staff perspectives on their own behavior and how their behavior affects the unit. The second section is services and behaviors related to patient care. The third is healthcare team behaviors regarding to things like race and payer status, partner status, obesity, language, substance use. The fourth section is healthcare team collaboration with patients and their support persons. The next is staff behavior toward one another and experiences with microaggressions. So using this survey, you might identify opportunities to reinforce or capitalize on things going well as address small or large issues that would help your unit improve. So one of the things that make this survey special is, in addition to having access to the survey and being able to administer it across your unit, is also the service that CMQCC is providing in helping our hospital partners interpret the results and discuss opportunities to address issues that you find important or noteworthy. Next slide, please. So this is important. Right now, it's important to note that the Culture of Equity survey is a pilot, and we're only running the pilot with members of our learning initiative. Once we complete the entire pilot, the entire Culture of Equity survey will be available to everyone in 2024. So if you are a learning initiative member, you can access the survey when ready. So when the time comes, you should contact CMQCC to create a unique survey for your hospital. And you'll likely have to get the survey approved by your hospital leadership. So you should allow time for that. And then once you're ready, once you have the survey approved and you're ready to disseminate, our team will discuss the best steps for administering the survey and encouraging completion across your unit. And so after you have disseminated the survey and we provide the results, then next slide, you'll be able to work with Terri and Christa, our clinical leads and our learning initiative co-leads to interpret your results. And this is really important because having a second pair of eyes when interpreting results is really, really important and really helpful. So our role here, to be clear, is not to dictate next steps based on your result. It really is to use this as a developmental exercise and to help you and your other unit leaders get to where you're trying to go in your work, and to see where there are things like variation in responses, emergent issues, places of consistency, places where you're doing well, where you can reward your team members, and then obviously opportunities to act and create new initiatives or new trainings or whatever that may be for your staff. So the Culture of Equity survey is one tool that CMQCC is providing. And like Terri mentioned, there are other employee engagement surveys out there. Not all of them, very few of them have questions, pieces, portions that are specifically focused on equity, which I think makes ours special. It makes ours particularly useful when talking about equitable and respectful care. So we think overall that this survey is a useful annual tool that can be used in a systematic way to improve your quality improvement efforts. If you have questions, feel free to follow up with your learning initiative co-leads, Terri and Christa. But for now, if you are in the learning initiative and you are interested, then we can follow up and get you started. So now I will transition to Christa Sakowski, who again is our learning initiative co-lead, and she'll discuss the final items for you to be aware of, as well as to wrap up this webinar. Thank you.
Hi, everyone. It's my pleasure to be able to talk to you today. We learned a lot about the Hospital Action Guide today and a lot about the Learning Initiative, and I'm sure everybody's really excited to go ahead and dive into that and get started. And we're going to talk about some of the ways that CMQCC is going to be able to help you along this journey before it's your turn or you're able to participate in the Learning Initiative, which will be available in the coming years to our California hospitals. Next slide. So one of the main things we're going to be doing is holding monthly office hours. So as you are previewing the guide, getting into it, and you have some questions, or you have some areas of concern that's happening in your hospital, maybe how to approach different committee members or administration about how to incorporate this work, we invite you to come to office hours to discuss that with Terri and I. We're going to be holding those on the first Wednesday of every month from 1 to 2, and these are going to start on September the 6th. So there's a couple of ways that you can register for these office hours. You can either scan the QR code that you see on the screen there, or use the link that you can see on the slide there. Once you use this registration QR or the link, it's going to register you for all of the monthly office hours. So this way you're already registered for all of them. You don't have to individually register month by month. And if you're not, you don't need to come that month, or you're busy that month, or you don't have any questions, you can just go ahead and skip that month. Next slide. So what are we going to do now, right? You're not part of the learning initiative, or maybe you are, but if you're not part of the learning initiative, what can you do right now so that you don't have to wait, that you can start moving on this work as soon as possible? If you haven't already, you want to work on building your internal hospitals equity team. And this might look a little bit different than your perinatal quality teams. You can incorporate all different kinds of players into an equity team. You can tap into administrative secretaries. You can tap into housekeeping. You can tap into other ancillary personnel that have an interest in this work and have valuable opinions to share on the team. It's not necessary or required that everybody that you incorporate into your hospital equity team has direct access to the data. That's not a requirement to be able to contribute valuable opinions and thoughts to this work. Another thing that you can do at your hospital is to, for those that do have access to the data center, or those that are able to share it, is to look at your own data and look at it stratified by race and ethnicity. We've learned over our membership calls over the past several months that a lot of hospitals haven't really started looking at a lot of their measures by race and ethnicity, and it can be very eye-opening to see some of the outliers that you have. So we can't address a problem that we don't know that we have. So we really encourage you to go ahead and look at your own hospital data stratified by race and ethnicity. Using the hospital action guide. So we learned a lot about that. Dr. Williams walked us through all of the great features of the hospital action guide and the resources that are there. So in being able to access the guide and begin your journey and conducting your own baseline assessment, again, whichever that you choose, is a great way to know where you're starting so that you know where you're going. Go ahead and register for those office hours that I just talked about so that you can get any technical assistance or support from us. And then you want to go ahead and register for our quarterly equity webinars. So our next equity webinar is going to be on November 15th, and there'll be another one following in February. In addition to that, we have an adjacent project that I'll be talking about in a second. So the way to register for the next equity webinar in November is either to use that link that you see on the slide there, or go ahead and scan the QR with your phone. And that'll get you all registered for the next webinar, which is going to be on patient experience baseline assessments and respectful care. Next slide. So our adjacent work, we've done an addendum to the supporting vaginal birth toolkit that really focuses on connecting with communities and doulas and midwives. So we've had a webinar series associated with this project that started in November of 2022. The next in the series is about partnering with doulas. And this is a little bit different. There are going to be ways that you can talk about building your own doula programs, but really the focus on partnering with doulas is how we incorporate doulas into the hospital care team, right? So respecting their expertise, respecting their value to the patients and their relationship with the patients, and how we can really incorporate them into the care of the patient respectfully to the doula as well as to the patient. So we're super excited to dive into this. That's going to be on August the 30th, so next Wednesday from 12 to 1:30. The way to register for that is to scan that QR or go ahead and utilize that link. Next slide. So all the resources that we found today, so now you all know how to access the hospital guide. The slides for this webinar are going to be available in 1 week on the CMQCC website. You'll be able to access this recorded webinar, excuse me, within 1 week on our YouTube site. And you'll get an evaluation that's going to come directly to your email within 48 hours so that you can give us a little bit of feedback on the webinar. Next slide. So thanks for joining us today. CMQCC works really very hard to provide you with as much support and resources as we are able. We did discuss quite in depth the toolkits that are available to you on various topics. The clinical leads are available for coaching and questions for any implementation support you need, not just on this work, but the other toolkit work. We have the Maternal Data Center and our fabulous Maternal Data Center team that can give you all of the support that you need to access and interpret your data there. And CMQCC works with a lot of partners. I saw a question about working with A1. We try to connect with partners all the time so that we synergistically kind of work on our work and support each other, and also advocate for hospitals, patients, and communities. I think that's it.
Thanks so much to everyone for joining us, and please check out in the chat the links to register for our upcoming webinars that Christa just referred to, and we will see you soon. Thank you for being great partners in this work.